First, I wanted to welcome our participants on Zoom, one of which is Tricia Petzold. She is down here in the lower screen, and she is our chairwoman, and she's a physician. Above Tricia, to the left here, is Monica Baskin. Dr. Baskin is with Virginia Commonwealth University. And then Mary Ellen Kahn up on the right side, who's the nicest person I've ever talked to, too. She's been a great help. She is from West Virginia University, from the Cancer Center, but we're going to start out with Tricia, if that's okay. And as up and coming and current beauty professionals here, I want you to think about the role of your job going forward, what that could mean for healthcare and what that connection looks like, because it's significant. You're in a position to really eyeball somebody that might not go to a doctor ever, and for sure will go to a hairdresser before a doctor. Okay, like, why not look good? The ship may be going down, but we're gonna look good. So anyway, I wanted to start with Tricia, who is the best chairman. She's really great at her job, a great leader. She has a background in emergency medicine. She has her own practice now. And Tricia, can you tell me a little bit about your practice and tell us about that?
Sure. Good morning, everybody. Thank you, Bill, for inviting me here. And it's just, I'm thrilled. I'm thrilled about this project that's going on, and to learn more about it and be part of it. I am a physician in Salt Lake City. I trained in family medicine and spent my first 18 years doing emergency medicine. In the last 8 or 9 years, I've been focused on integrative health, prevention, teaching at the medical school at the University of Utah in health promotion, integrative health, and culinary medicine, which is food as medicine. So this idea of connecting with community, thinking outside our medical system, which is really a fixer system, to more of a prevention space is really exciting. And as I was thinking about this conference, I started thinking about my training, and one of the elements of my training that really resonated as similar to what you're doing in this incredible concept you have here is the Yukon-Kuskokwim Health Corporation, which is a rural health organization in Alaska, where we would be centered 400 miles west of Anchorage, and smaller communities, villages would have community members observing each other and caring for each other and calling in once a week to say what they're seeing. And the physician on the other end would suggest medications, treatments, whether they needed to come into to the medical center or not. And really what it did was bring humanity, or this was 30 years ago. There was humanity in medicine, and I think what's happening here is bringing humanity back to caring for each other and to medicine, and really raising the level of which we can implement prevention. So I'm inspired by this project. Thank you for having me here.
You're the best, Tricia. Tricia is joining us from Utah, so we are grateful for her. Dr. Petzold, when you were in emergency room medicine, did you ever see skin changes that turned out to be cancer?
Yes. So frequently, I would be seeing someone for a dislocated shoulder or some other traumatic event or medical event, and they may bring up the idea that this scab on my hand or my arm, it hasn't healed in months. And so as a side note, or another one, and so I would send them to their primary care or a dermatologist and have it biopsied for further care and diagnosis. Most of the lesions I saw were pre-cancer or less concerning cancers, but there were a few events where just this dark mole didn't look right. And a couple that I can think of right now are young females who I sent off to a dermatologist and ended up being melanoma, and uh, and really didn't come in to see me for that condition. So in a very similar sense, I was there doing something different, like someone here would be doing hair or nails and notice something on someone's skin that was unrelated to the job I was doing with a person. So
Observing everything in front of you, really, just right.
Right.
Look, taking the whole person in, which I think is key. What did you do if somebody would say, listen, I don't have a provider, I'm patched together? What was your next step? In your case, what would you do in those situations?
So it varied. If it was something that I had low concern for, I was in a position to do the biopsy myself. But the concern is, where's the follow-up? And if it was something dangerous, that was concerning. So my go-to was to communicate with our social work community, get the person connected with the health community health centers that can follow up with them through the social work outreach, and get them to the primary care community health center that could do the initial care and get them tapped into the system.
Right. Dr. Petzel, today we have barbers and cosmetologists with us. They see people every day. They see things that are different. Do you have advice that you could give them when they see something that they're concerned about? You know, what should they say? We say when you see something, say something. But
I love that. You know, thinking about this project, really someone in this profession looks at scalps and skin far more than an emergency room physician does. And so really knowing what looks typical, what looks similar to what I've seen before, you're in a very unique position to really notice something's a little bit different. There's a saying that we pass around in medicine, accredited to William Osler, that it's far more than understanding what disease a patient has, is understanding the patient who has the disease. And so I think that concept of knowing and being trusted by the person you're working with, and knowing what's familiar and what looks a little bit different, are two really huge strengths that someone in this business has. And again, I think it's that humanity piece. So I think being able to say in a kind way that this looks a little bit different, and I think it's really important that you are able to, that I send you to a health professional to take a look at this. And, you know, I was thinking about how even in the emergency room, if I see something I'm not really sure about, I'll often grab somebody else and say, Dr. Smith, will you come look at this with me? And that's really just something you can say is, I'd like a second eyes on this, what I'm seeing in your scalp. It may be just fine, but it may be something to be concerned about. And let's get a doctor to look at this, or let's get the health clinic to look at this.
Great. We're so grateful for you, Tricia, being here. And appreciate everything. We're going to circle back with if there are any questions or anything. But we first wanted to hear now from Dr. Baskin from Virginia Commonwealth University. Thanks again, Tricia, and please, everybody, stay on as long as you can. We're so grateful to have you here. Okay, Dr. Baskin, she is also on our board of advisors and is a wonderful asset to the work we do. As a scientist, as a PhD, a psychologist, she really understands disparities, the difference in health by zip code. She understands rural and minority communities. And actually, we are the first, I think my first conversation ever was with Dr. Baskin around manicurists and some of those issues that can come. So I'm not going to go on here, but welcome and thank you for being here.
Thank you so much, Bill. I am delighted to share with you all today and be a part of this very important workshop. So the only regret I have is that I'm not there in person, but really bring you greetings from Richmond, Virginia, where I serve as the Deputy Director of Research for the Massey Comprehensive Cancer Center, one of only 2 NCI designated cancer centers in our state. So really excited to be here to give you a little bit of information and maybe answer a few questions, but really excited to have you all learn a little bit more about what you can do in your community to help to screen for skin cancers.
Which is great. And we have discussed minorities at length relative to skin cancer because, you know, this idea of tossing sunscreen to everybody, while it's very helpful, isn't always the key. And skin checks are everything. And we've talked about melanoma and black and brown skin before and what that translates to. Is there anything that you can expand on there as an example?
Yeah, definitely. And just back to your point, I mean, I think I even have a few people in my household that I had to convince that you do still need to have sunscreen, even though we have darker skin. And so I think it's really important. The sun is beautiful. As you see, part of our logo for Massey, we've got this big sunburst. It's really powerful, but it can be very damaging to your skin. And recognizing that your skin is your largest organ. So it's everywhere and we've got to protect it. So I think things like sunscreen are really important for all kinds of skin types. But the other thing that is important with darker skin individuals is to move past the myths that having darker skin means that you won't get skin cancer. That is totally false. But also recognizes that it may show up in different places than what you might typically see in a fairer skin. So I think that's really important. And as stylists and barbers and nail technicians, you all are in a perfect place, as was mentioned by my colleague, Dr. Petzel, to be able to see things that your clients may not see on a regular basis.
Especially because we know that melanomas and people with black and brown skin are frequently like in the palms of their hands or the soles of their feet or fingernail beds. Is there more that you could expand on that?
Absolutely. So what we know for sure is that while, yes, people with darker skin can get melanomas, it is less likely. But we also know that when those complexions have the cancer, it's typically more aggressive, and it's usually leading to poor outcomes. So people tend to die, for example, a little bit more regularly if they are of black or brown skin and having a melanoma. So the problems with that, there are a lot of different reasons for why that may be happening, some of which is they're getting diagnosed much later. So with any cancer, we've got great treatments out there, and the sooner you can detect it, the more options there are. So sometimes the disparities in terms of individuals of racial ethnic minorities are because they're getting diagnosed much later. And then the other issue, a part of that is because they're not looking in the right spaces. So I mentioned before, looking at the bottom of your feet, for example, there are oftentimes different spots and things like that might be there that people aren't paying attention to. But say if somebody's coming in for a pedicure, what a perfect time to be able to observe something, especially if it looks like it's changing in shape, or someone's giving the example, Bill, that you gave earlier, that something, wasn't or Dr. Petzel, something wasn't healing. So those kinds of things are really important. And then behind the scalp, sort of making sure that you can see that. And sometimes it's a little bit more difficult if the spot is very similar in complexion to the person with the darker skin, as opposed to someone with a fair skin. It's a little bit easier to see, reddening and darkening there.
Well, we've also talked a lot about minorities, trusting health systems, and then also trusting providers, and also what are the solutions. Frequently we hear from people who say, you know what, I can't deal with, I don't have the money, I don't have the insurance, I can't go forward. And so, is there anything that you can add to that? Like here, we have people here today that can connect the dots on that and provide solutions that we're excited about. But can you expand on that at all?
Yeah, absolutely. I'll go back to one of your introductory statements. I think, I am a scientist. I'm a psychologist, but I also am a scientist. So I definitely focus on the idea that everyone should do their homework, should really look for credible sources to get information about, whatever it is that they have concerns about with their health, and especially about cancer. There are a lot of reputable places that you can go to, including places like your cancer centers, cancer institutes, and my colleague will come and talk a little bit more about what's available right there in West Virginia. So I think that's important. Trust me, I understand, and I am not attempting to go into a conversation about who is trustworthy and who is not. I think there are a lot of reasons why people may not be as willing to go to certain individuals or to trust them. And that's where I think stylists and barbers and technicians really have a leg up on some of us who sit in the healthcare professions, because you are the trusted sources in your community. People are coming to you. They are entrusting their health, their beauty, all of that to you. And so if you have just a few things to say of encouragement for them to go and get something checked out, your voice is going to be extremely powerful, because you are the person that they know and trust. And you probably have, work with them, and depending on your age, you might have worked with their parents or their kids. So you are part of the extended family. So I think you definitely have a vital role to extend and serve as that gap between community members and the healthcare system.
Absolutely. I think when people, you trust people with your face, that's a big deal. That is a big deal. Nobody's doing that to anybody, and they chose you. So when they're trusting you with that, that's critical information. Yesterday we were in the car talking about nail technicians and fingernails and how lesions might show up on nails. I actually think, was it Bob Marley that had melanoma that died? And he had melanoma in his toenail, I think, right? Yeah. And so can we talk a little bit specifically to nail technicians? If they see something in a nail, what might they do?
Yeah, I think it's a great point, and especially many of us ladies, especially in the summertime, like to keep those toenails painted all the time. And so that could be hiding what could be something under that nail bed. So I think it's really important to encourage your clients to take that polish off on a regular basis. Or if you have taken it off and you notice something, definitely, point it out to them and try to encourage them. Hey, maybe we should leave off the polish on this, particular nail until you can go and get that checked out. I know it's going to be hard, but really tell them it's really about their health. It's not about, how cute they look or they don't look with that one nail that may not be painted. But it's really important because, again, things that are hidden there, may continue to grow, and we don't really think about it so much. But if you can catch those early, you have the early detection of that cancer. Again, there's so many more viable options that are there that we know will help to have people to survive from skin cancer and other cancers for many years to come.
That's great advice. And Dr. Baskin is a behavior expert that's world renowned. So when that notion of there we go, that notion of saying, hey, wait a minute, I don't want it, because yesterday in the car I was like, I can't imagine somebody dropping money and then taking that off to go to the doctors, right? They're a lower priority anyway because they're at the nail technicians first. So, maybe it is a good idea. We just don't paint that nail, and by being naked, it's going to remind them, because out of sight, out of mind. And we know that with less cancer and prevention, the work we've done, when things take on the natural landscape of our lives, we stop seeing them, right? Yeah. I grew up in a household of smokers, and 10 people are going, what's the problem? we're all in a haze. Nobody can see what the problem is. But, I think that is critical advice. Is there anything else that you might suggest before we move on?
Yeah, I mean, I think, again, as that trusted member of the community, you're going to continue to do what you always do. I mean, you're client focused, you're kind, you're going to be checking in on people's families and all of that. I think having the conversation about health broadly is what you do. I mean, you are experts in hair and nails and skin. And so using that expertise to gently encourage someone to go and get something checked out for their health. And even if it's not for them, think about all the family members that rely on them. And so I think just continuing to encourage, to nudge them, and then, connect them with resources, which I know we'll have a little bit more conversation about that, about what resources are available, especially in communities where there may not be as great transportation, or there may be concerns about, co-pays and going to, insurance issues and so forth. So I think, again, just continue to do the great work that you're doing. And you never know, you plant a little bit of a seed there. It might actually help someone to get a diagnosis much sooner and certainly have them into
Save a life.
treatment. Yeah, absolutely.
And there's nothing, like, emotionally speaking, there's nothing more important than really being seen. And some of us have all been to providers where even I at 6'6" was invisible, right? So how, when you're really seen and you're knowing you're being seen and you're present and connected, people listen. So use your power, right? It's a very powerful, honored position to be in. People are seeking your attention, and you are present and paying attention and can make a world of difference, including saving a life. So Dr. Baskin, you're an amazing human. We're so grateful for you. And if you'll stay on, that would be great. And we're going to move on to Mary Ellen Kahn, West Virginia University's Cancer Institute. And we are so glad you're here, Mary Ellen. Thanks for being here. We've had some good conversations on the phone, and it's been fun to get to know you. And good to know there's such a valuable asset here in West Virginia as West Virginia University. I mean, you're really so amazing, and we're glad you're here. There's so many things to talk about with you. You've been with them since 1993, was that right? How long have you been there?
1991.
Oh, my bad. But
Yeah,
amazing,
as I told you
right?
on the phone, I jokingly say that I was 12 when I started. But just a little about me. I'm born and raised in West Virginia. I have lived here all of my life. And while my job, while I'm physically housed here at the Maine Cancer Institute in Morgantown, the work that I do and the work of the many programs that are in our Department of Cancer Prevention and Control, we really work in communities all over the state. And so I've been blessed to have a job where I've been able to work with community cancer coalitions, faith-based organizations, community health centers and free clinics, and really get to go out and work side by side with people who, are dealing with this every day. And as Dr. Baskin had mentioned, and I echo this wholeheartedly, you all and the work that you do, you are that trusted source in the community. I often say that, we can come and do a program and, provide education and talk. But really, when people are needing information or needing, some suggestions on what next steps that they should take, oftentimes it's, if it comes from someone that they know, if it comes from someone that they trust, that message is received much more readily than if it's coming from someone who is not from the community. And so one of the things that I did want to mention is that, I'm with the Office of Community Outreach and Engagement. And we, as I said, we do work all over the state. We do have a commitment to providing awareness and education. So events like today's training they are so important in building, people's ability to, build the health of their community. I did provide something for you all, these little kits. It's a melanoma sun safety kit for ultraviolet light protection. But what I really like about this, it does have a little card in it that is a melanoma card, and kind of what are the visual signs to watch for with melanoma, as well as tips on the back of the card about things that people can do to protect their skin. And then I also wanted to mention that with the Cancer Institute, in addition to that commitment to awareness and education, we're also really committed to trying to enable bringing care close to home. And there's a couple of ways in which we've been doing that in local communities. One has been through mobile cancer screening, as well as partnerships with community hospitals. And this is to really help to alleviate the burden that many people face when they have to travel long distances to receive care. So we've been providing breast cancer screening in Logan County through the mobile mammography program with Bonnie's Bus. And I am very excited to announce that we are now capable of providing mobile lung cancer screening in your community as well. So the mobile lung cancer screening unit, it's called Lucas, and it screens patients with a low-dose CT scan. And both of these units, they partner with local providers and clinics to host the visits and be that local medical home for patients, so that it's to be able to get your results and any follow-up that they may need. And then with the mobile units, we do have some navigation services for anyone who is needing navigated to further diagnostic and further treatment. And so I really wanted to make mention of this because Bill and I had a great conversation about starting to look at, can we explore, and are there some ways that we can try to build in some other types of cancer screening, such as skin cancer screenings, that can be done in conjunction with some of these mobile visits. So it's a great opportunity that we're looking forward to, seeing how we can do that and provide more for your communities.
Well, you're doing amazing work, and this is a complex state to meet a lot of unique needs. And we're so happy that you're here with us today. Can you, just a couple questions, can you share with our audience here what your biggest barrier is in West Virginia? What are your biggest challenges? Like let's just do one. What would you say is your biggest challenge?
Yeah, I don't want to go with the usual suspects of, travel and, as you've experienced, Bill, time, right, to get to places. I think one of the biggest barriers that we see is that, oftentimes there's a reluctance to seek that care. Even if there's a symptom or something, many people still have hesitancy about getting it checked out, and the fear of the unknown, not wanting to know if they have cancer. And so one of the things that I've often said as I've done community education is that the mantra for me is, when in doubt, check it out. Because not getting it looked at, the earlier that you can have it checked out, determine what it is, and then that's much quicker how we can approach that.
So let me ask you, from that challenge, what are your biggest lessons? Like, are there any tips that you can share with the people here today?
Well, as we talked about earlier, is that, having that trusted person that they know, that is key for so many people. That is what is oftentimes going to nudge them to take the next step and to, get something looked at, or to have something further done. And so don't underestimate the ability that you have and the importance of the role that you have, because, people are much more likely to listen, to take advice, and to take action if it's coming from someone that they know and they trust.
Exactly. So I'm going to ask you to do a big reach here, Mary Ellen. If you had a magic wand, just like magic wand, what is one barrier that you would just go, poof, it's gone? Just anything like that?
Definitely, related to cost,
Yeah.
because coverage
Cash.
of, screening and treatments is a concern for a lot of people. And I know we're currently, in situations where, we are a Medicaid expansion state. So there are some concerns about continued coverage. So yeah, if money and was not an option and as you said, if we could wave the magic wand, it would really be about eliminating issues of
And
cost.
when we eliminate cost, we increase access, which we know that access is really a problem here. And so access is a problem in a lot of places, not just here, by the way. But there are challenges here, and that's where you guys come in. That's where everybody in this room comes in. And West Virginia University's Cancer Institute doing amazing work. And I'm glad you're going to be in the neighborhood. Do you know when your mobile van is due to be in this area, or do you have any information on that yet?
I don't readily have that. I can pull the schedule, and then I can follow up and share that information.
That would be great, and we'll share it with everybody here. Maybe we'll get Caleb and Lisa to just kind of spread the word. That would be great. So grateful you guys are here today. Please stay on if you can, Mary Ellen. Really appreciate you being here. And now we are going to move on to kind of King Kong of this whole event is Caleb Runyon. We're so grateful to Caleb, who I mentioned earlier I was connected to about sharing the information. And he's been working on a passion project as a nurse practitioner, and also you're a surgical fellow now, is that correct? And his passion project is all around melanoma. I'm gonna let you talk about that. Can you come up here so we get all of your important stuff online? It's up, it's going, it's running. And so before we start in with any demonstrations, let's talk a little bit about recognizing the most common cancers and explain it at my level, C student Bill level. Okay.
So, anytime that you think about skin cancer, cancer at its very core is a proliferation of abnormal cells. So it's going to be abnormal appearing on your skin. So you should not be seeing things that are, having pain associated with it. You shouldn't be seeing ulceration, bleeding, excessive scabbing. If something starts to heal but doesn't quite heal, those are some things that you may be, looking for. There are specific signs that are related to each type of skin cancer. So basal cell carcinoma is going to look like a pimple. For a lot of us that, have pimples or acne, breaking out right now, you may think that this is just an ordinary pimple, but if that pimple lasts for several weeks, 6 to 8 weeks or so, it's not a pimple. And so common sense kind of comes into play there. Looking at squamous cell carcinoma, you may see an abnormal growth of, dry skin. And that's very, simplistic with the terminology, but let's make it simple for our patients and clients as well, because, I can say, squamous proliferation all day long. That means nothing. And so, just thinking about anything that looks unusual to you. Okay. And then of course, melanoma, that's the most important because it's the most deadly. And so with melanoma, there's the classic A, B, C, D, E of melanoma, which I'm sure most of you are familiar with. So A stands for asymmetry. So if you were to cut a circle in half, right down the middle, both sides should be even. And so if they're not, that's asymmetric. B is for border. And so border, if it's jagged, if the edges are kind of rough, it shouldn't be that way. C is for color. If you see multiple colors in a mole, that could be concerning. D is diameter. So 6 millimeters or more, which is roughly the size of a pencil eraser. And then E is evolution. So is that mole evolving? So you start with this, little tiny brown circle that it slowly starts to change. That would be another sign of concern.
Cool. Couple things. The Closer Look project, which is what Caleb started. Can you, before I ask a couple questions, I'd like you to just talk a little bit about that.
Yeah. So the Closer Look project is, like Bill said, a passion project of mine. I am a dermatology nurse practitioner, and so all the time I was seeing my clients, my patients come in and say, my hairdresser noticed this spot, and that was pretty often that I would have that conversation. And 8 times out of 10, it was, malignant, cancerous. And so my mom is a hairdresser and has been for 25 years or more. And so in the back of my mind, I always thought this could be something, this could be something where I can educate hairdressers and tell them, these are benign findings and these are not. And kind of tabled that. So then in February of this year, my grandpa was diagnosed with stage 4 melanoma. And so for me, incredibly difficult to comprehend or to conceptualize, because I work in dermatology, so I should have found this. And so for me, it's one of those things that if you can place someone at an advantage to help your loved ones, then why wouldn't you, right? And so, my papa is someone who is from Logan. He's 76, does not want to go to the doctor. You have to pull him out of his house to go to the doctor's office. And I understand. I hate going myself. But you will not see him without a haircut. And so I thought, what a great position, what a great time to kind of bridge the gap with our trusted professionals and our family and our community. And so the Closer Look project started out as the Hairdresser Dermatologic Detection Initiative. Mouthful, right? And I can barely say it myself. And Bill and I were talking about it, and he said, these are people who aren't in healthcare, so you should change the name. And I thought, you know what, Bill, you're so right. So the Closer project came to life. And so, at first it was focusing on hairdressers, but it's expanded to so much more than that. It's hairdressers, estheticians, barbers, tattoo artists, massage therapists, nail techs, boutique personnel even have been involved in our workshops. So, it's just a wonderful project, and it's reaching a lot of people. And if we save one person with this project, the job is done, So.
And already through his social media, he has started a Closer Look project feed. In his own feed, he shares very helpful, palatable information that's easy to do. We're not asking anybody to diagnose anybody here, because as we discussed in the beginning, this is up to the providers, those with degrees, advanced degrees, and I myself never really communicate science unless I'm with a scientist or a physician or a provider of sorts. So it's all about the resource. And we don't want to work outside of our ability to actually do something. So we're going to talk a little bit about that. Thank you. I think your story is great. I was certainly moved by it. Less Cancer started over 20 years ago by myself for a very personal reason. And we ended up being founders of National Cancer Prevention Day, the National Cancer Prevention Workshop. And we have made workshops available to hundreds of thousands of providers actually around the world. I just wanted to mention too that we are a grassroots organization and we function on bake sales. So we don't have a big fast food company sponsoring this, or there isn't a suntan company sponsoring this event, or we don't do that. We don't mix science and education with special interests. You're our special interest. Everybody is our special interest. And our founding principle is less cancer for everybody, not for some, for everybody. So we're really grateful that you're part of this process. So Caleb, what is one simple step that we hope everyone here remembers when looking at a client's skin? What is one simple step?
I think one simple step would probably be, you may expect me to say like, assess their skin, memorize the signs of melanoma, but that's not it. I think seeing something and saying something is probably the most important. Like I said, if something's unusual, something looks off, just mention it, and just make sure that you communicate that effectively. I think that would be the most important tool.
So how would you reassure everybody in here today, your whole demographic, barbers, tattoo artists, nail techs, everybody, can you reassure them that they don't need to diagnose, they just really need to observe and encourage? And how would you best go about that?
Yeah, I mean, Bill mentioned advanced degrees and providers, and every degree is very, very important. For me, my mom and I had this conversation yesterday. She may not be able to tell you what a basal cell carcinoma is, but she is going to be that trusted link that bridges the gap between our clients and patients and saving their life. And so everybody has a very unique perspective and a unique ability with this project as a whole. And so but it is important to make sure that you establish those boundaries and you establish your scope of practice. We all have our scope, right, within the Better Business Bureau or whatever. And so just making sure that you let your clients know, I'm not a provider, and me telling you that something is suspicious does not mean that it even is, right? It could look suspicious. I've had several moles pop into my clinic that were nothing, absolutely nothing, and I thought they were. I biopsied them. So the main thing is just saying, hey, I'm not a provider. This does meet criteria that says this can be concerning, and here's what we should do about it, and we will get into our partners with Coalfield Health, but referral processes are being placed right now as we speak, and it's really going to be a great community project as well. So,
great. Well, those are important things. We're going to have you come back to do some demonstrating that we want to see, and I'm going to ask Lisa to come and join us up here. Could you hand the mic over to Lisa? Thanks so much.
Hey, Bill, this is Mary Ellen. While you're waiting for Lisa to come up, I just wanted to comment. I did get those mobile mammography visits for you. I put them in the chat.
Okay, good.
But I'll just briefly mention. So Bonnie's bus is coming to Chapmanville, and that's going to be, in Man, West Virginia. That's going to be on October the 2nd.
Good.
I put the number, Southern West Virginia Health System is hosting the site, so there's a number for them if anyone wants to call to schedule an appointment. Lucas, the mobile lung cancer screening unit, their schedule was pretty full already for the fall. So there's 2 visits in Logan that are going to be in April. April 28th, they'll be in Man, so it would be the same phone number as the Bonnie's bus visit to call to get an appointment. And then on April 29th, they'll be in Chapmanville, and I included the number for that one as well.
Excellent. That's such great news. We appreciate your great work. I also wanted to mention we got your terrific, helpful information and Dr. Baskin's. Students and others will be able to pick that up here along with some Less Cancer swag. So we appreciate that. So next up is Lisa Haddix-Heston, who
I don't know why I'm up.
you're up because she has a crazy good story, and because I was like, wait a minute, I got to hear your story again. And so I don't know if everybody knows this here, but Lisa is a dentist. Does everybody know that? And Lisa, can you tell us a little bit about your current job, a little bit about your history? And the reason I really wanted you here today is because as a lifelong West Virginian, you really have been on the front lines of rural health, and you've seen many, many things. And to me, those are treasured stories. And these stories are transformative for people. And personally speaking, for my project, Caleb's project, they're the stories that matter and they make a difference. So can you tell us a little bit about your background? High school, when did you get out of high school? We'll fast forward. We're not going to talk about Christmas, Easter, all this thing. Okay.
Do I need to do something?
Yeah, I think it's on. Isn't it on? It's on. It's good.
Okay.
You're good.
I probably don't even need it.
You do for the...
Okay. For you, I will use it. But before I even talk about my high school, I've got it. I have something you don't even know.
Okay.
When my family moved here in 1957, this space that we're in right now was my dad's dental office.
Is that correct? Did you know this? That's crazy. I did not know.
I
that's
remember
amazing.
coming here when I was just a wee little thing.
Wow.
And but fast forward to high school, that was 1957 and 1960, and then he moved his office. I graduated from high school in 1972, so I'm ancient. When I went to college, I wanted to go into physical therapy, but I was only 16. And when I went into the physical therapy clinic, it broke my heart to see everybody. I got back to my dorm and I called Mom and Dad and said, I can't do this. I can't do it. I want to take them all home with me. Dad then said, why don't you go into dental hygiene? At least your patients will be ambulatory. So I went to dental hygiene school thinking I would meet a dentist and get married and not have to work. And then when I got out of dental hygiene school, I came back to Logan in 78. I was working for my dad. And back then we did not have expanded functions. So all we could do was clean teeth and take x-rays. And within 2 months of practicing dental hygiene, I knew I did not want to be a dental hygienist. So I'll go to my dad. I don't want to do this all my life. And he said, what do you want to do? And I said, well, how about I go to dental school? And Dad said, how about you go to dental school? So I did. I had my own practice for several years. My husband became disabled. My mom was disabled. I was taking care of 2 households. I sold my dental practice in 2000.
Which, let me just say, no dude anywhere in the world is going to do what she did. They're not selling their money maker to go take care of family members. That's not happening.
No.
But ever.
And my finances took a hit.
Yeah. No, but I love that you did that. And I love that your dad was kind of the great feminist. Like, he was like pushing you ahead.
Dad graduated from the University of Maryland College of Dentistry in 1954, and there was a trailblazer in his class, a woman, I cannot remember her last name, but a female dental student that he greatly admired. And he was a big feminist. He was, you can do anything you want to do, girl. Right. You know, and so anyway, I finally got my mom and husband where they were somewhat ambulatory, and I found out that the college was going to develop a dental hygiene program. And I started going to the advisory meetings, and most of my dental colleagues that were on the advisory committee there basically told the people at the college, this is your person. She was a dental hygienist, blah, 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 and now she's a dentist. And so I was hired to develop and get accredited the 4th dental hygiene program in the state of West Virginia, which I did. We were there for 10 years, and dental programs and dental hygiene programs are historically the most expensive programs for any college or university to have. So we kind of came down to, it was a financial decision to discontinue the program. And then one of my graduates called me, begging me to come to Gary, West Virginia, because he did not have his general supervision license and their dentist had left. And he had a new baby to support and he couldn't work without a dentist in the office. And so, yeah, I started driving to Gary, West Virginia from Logan.
How long is that? How long?
It's about an hour and a half.
How many?
Hour and a half, 3 days a week. And they wanted me to stay down there, and I was like, nope. So I would drive down, come back, go back down, come back.
Amazing.
But that introduced me into the world of federally qualified healthcare centers. And so Southern West Virginia Health System got wind that I was in that arena, and they called me. And I told the people in Gary, when they found another dentist, I was not coming down there anymore. And so I ended up going to work for Southern West Virginia Health System for 9 years, and I was the school-based dentist in Lincoln and Logan counties. And I drove all over creation every day of the week. During that time, I was appointed to the Board of Governors at Southern West Virginia Community Technical College. I became the board chair. And in my 4th year as board chair, the position of Dean of Allied Health and Nursing at the college opened up, and I resigned from the board and threw my hat in the ring, and here I am.
Can you tell us a little bit about that college?
that college is, and Brent is on our board of governors.
I'm good.
That college
It's a 2-year community college.
It's a 2-year
And the
community
name
college.
is?
Southern West Virginia Community and Technical College, and it is a game changer for people of this region.
Yeah.
When I decided to go back to dental school, I had to get 8 hours of physics and organic chemistry before I even applied, and I took my first physics class at Southern. So
Good. How long's that
Caleb
school?
went to Southern.
Caleb, it's a great nursing school. And we actually, Les Cancer has a scholarship there now,
Yeah,
which is good, right?
I actually mentioned that to my director of nursing this morning.
Ah, okay. Good.
So
Well, hopefully it will help. And the work that you have done has been pretty exciting, because I think a lot of people in other parts of the world or the country that I have been in and we've done these workshops or have, this is a really unique rural health experience. I mean, I don't know if we're finding dentists jumping in the car, driving 3 hours a day to I mean, your story is unique.
My household was I was raised to be very service oriented.
Right.
So,
And did you say your mom was a teacher?
no, my grandmother was a teacher.
Right. Good
And,
memory problems.
No,
Right.
that's fine. But actually, my mom wasn't a teacher by profession, but she was a great teacher.
A good educator. Well,
Yeah.
clearly she raised you. But you have found yourself in all these kind of crossover roles of serving community in West Virginia. And I love that. And I love the fact that you are bringing up a next generation of providers too, which is great. One of which is right here and the founder of the Closer Look Project.
Right.
So, we have so much exciting stuff going on here, and you've had a front row seat and have actually been part of it. So I wanted you to talk today a little bit so I could thank you, and thank you for your amazing work. You're doing incredible things.
Thank you. And I wanted to say hi to Mary Ellen. I'm on the advisory board at the West Virginia University Cancer Institute.
Yeah.
And we are so glad to have you, Lisa.
I'm so glad to be a part of it.
So thank you for being here. We're so glad. Why don't we talk to Shayla first? Is that okay? Can you hand the microphone to Shayla?
I surely can.
Tell us about where you work and what your role is, and tell us all about yourself here.
Okay, so a little bit of background about myself is before I decided to go into administration, I actually worked in the laboratory in pathology. So I worked really close to pathologists. So I was able to help with biopsies and making sure that we were not cutting the sample away, because it is hard, and it is hard to get patients to come when they're scared. But that's a little bit about me. A couple years ago, I decided to go back to school. I am the associate administrator at Coalfield Health Center, which is an FQHC.
Can you tell everybody what an FQHC is?
Yeah, so it is a federally qualified health center, and we are able to offer services at a discounted rate. We call it the sliding scale, and it's based on income and how many is in your household. But if you do not have insurance, it is a way to still have services.
Right.
For as little as $15. I mean, so we're able to provide that along with a 340B pharmacy program to help patients get medication at a discounted rate as well.
Mm-hmm.
So
Is that status a nonprofit status? Can individuals donate to your services? How's that work?
So we are grant funded.
Mm-hmm.
We work off of grants and patient services.
Gotcha.
Mm-hmm.
Gotcha. How long has Coalfield Health been around?
It's been around about 13 years. We sit in the heart of Chapmanville. We're very proud of our community. And that's why when Caleb called, I was so honored that he would ask us to be a part, because we love our community and providing services to those that are underserved. because there is such a need in our area.
In a lot of areas, not just your area, like across the country. And so we're finding ourselves where we have to be really creative in pivoting and finding solutions. The one thing I love about you guys being here, and we'll hear from Brent in a few minutes, is the fact that we're here to help people see something, say something, and send somebody somewhere, which is Coalfield Health or West Virginia University, or, we have some great local resources here in the state. And, I've always thought it was a little tough to talk to people, educate people, tell them they have a problem with no solution.
Yeah.
Right? And I think there are people that get discouraged that are, seeking health care, or they've been diagnosed with something, or they just don't want to hear about it because they don't have any solutions. Like if they, for instance, did have a cancer diagnosis, how, where, what, how am I going to make that work? I don't know if I can deal with that. It's overwhelming. Yes. And I personally have dealt with a lot of overwhelmed people where it's really, and for good reason. It's not like some internal neurosis. They really do have a path going forward that's quite complicated. Transportation, yes. That's a health disparity, right? Yes. Money, access, how are we going to get around? How are we going to deal with this? Is this going to be a job that's partly done? Is it a job fully done? So fortunately, there's some resources here in West Virginia that can help you. And we are here today to hopefully take some of those complications and hurdles out of the way, because they're significant and they're real. And we hear you, Less Cancer hears you, and we're very serious about it. When we talk about less cancer, it's less cancer for all. So I wanted you to speak first because I want to thank you for your important work. You've really done a great job. And
I appreciate you all having us. We just want to empower our clients and patients to take control of their health. So we're hoping to be able to do that with you.
Great. Thanks so much. Be careful stepping out of that. There you go. And can you hand the mic to Brent?
Do you want me to sing?
Yeah. Come on, Brent. So, Brent, tell us about your job at Coalfield Health. Tell us about.
Well, I am I'm the CEO at Coalfield Health. I've been there just over a year now. I'm originally from Chapmanville. I went on to college and got a master's degree in healthcare administration. Started out in pharmacy. Realized that wasn't the track that I needed to take. It just didn't fit my personality.
And who wants to stand all day?
Yeah, that's what I said. Varicose veins are a thing. But no, being young and naive and having no clue what healthcare was, I went into the hospital industry because that's what that's what I thought you did as an administrator. Kind of worked in some business development, and then got into practice management. So I got into managing some specialty care facilities, and then moved on from there. That was at a large tertiary facility, and then moved on to a critical access hospital, a little closer to home, Boone County, the next county over from us. Worked there for a period of time. Practice management, business development, physician recruitment, and that was kind of my background. Always looking for a way to get back to Chapmanville. I moved away to Charleston, which is where I live now, but Chapmanville's always home and Logan County's always home, so I had an opportunity to come back to Coalfield. So yeah, I've been there for about a year now, and
I'm glad you're here, and I'm glad you're here today. Coalfield Health has been recognized nationally. What does that translate to? How have you been recognized, and how does that translate to?
Yeah, I think on the national scale, we're probably known for our quality. I think quality, you know, we've received numerous awards over numerous years, really at the state level as well.
Yeah.
But, you know, there's requirements in healthcare that you have to meet and do. But when you exceed in those, you know, providing, you know, exceptional care, doing a lot of preventative measures, you know, really staying with the up-to-date technology. I mean, you can go on and on about, you know, what different things. But I think that's one of the things that we're most proud of at Coalfield is the quality of care. And, you know, we try to give the, you know, the family approach to taking care of our patients. And I think that it's kind of the embodiment of our providers as well as our staff that, you know, we would want to treat all the patients like we would family. So
I love that. Can anything come to the top of your head where you believe you're strongest in some of the cancer prevention screening areas? Is there a area that you feel that you're especially strong in?
You know, I don't know. That may be something for Anitra to be able to answer. I mean, I know we do, you know, numerous cancers, or not cancer, but we do numerous screenings, but I don't know anywhere that we really stand out. Do you know, Anitra? Not to put you on the spot. Do you know, Shayla?
So we focus a lot on our screenings and prevention, trying to teach people how to be proactive instead of reactive. So we have a mammo bus that comes once a month.
Can we hand the mic to her? Would that be okay?
Yeah, sure.
Thanks.
So one of the things that we do with screening is we provide the mammo bus once a month to come into our clinic and do mammos, and then we have every quarter the CT machine that they had mentioned. We use Vandalia Health. Their bus comes down and does the low dose CT screenings as well. And we offer different screenings for colonoscopies. So those are some of the things
That's
we really look forward
significant.
to.
That is significant. And where are the colonoscopies performed? I'm just curious where that is
So there's
accomplished.
we let the patient decide whether they want they want to have treatment. Of course, we support our local hospitals and surrounding counties, and then there's other screenings like your Cologuard and those sorts of things that patients can do at their home.
So you guys have a partnership with your local hospital?
Yes, we refer.
Great. Perfect. So that is great. Actually, what I'd like to do, if it's okay with everybody, is bring Caleb up again to demonstrate how we might go about looking or identifying, and then we're going to just open this up for a conversation, if that's okay. So Brent, thanks for being here. I'm super glad you were here, and we are really grateful for your work.
Likewise.
And you keep going, because it's amazing work, and you're saving lives every day.
Thank you very much.
Thank you.
So this is Caleb Browning. He is a barber. Tell me the name of your shop again.
Hillbilly Barbershop.
Hillbilly Barbershop in Man. And so today I'm going to kind of demonstrate basically just a scalp head exam, and nothing too complex or anything. Just kind of showing how on a man I would kind of go about a scalp exam. So. And
also the tattoos are an interesting journey. I'm glad you've got them because Caleb Runyon can explain a little bit about that, and we'll look forward to it.
Yeah.
Can you hold the microphone, or do you want me to hold it while you examine? Okay, good.
No problem.
All right.
So, so when I start to look at a scalp or any type of skin exam, I always start kind of systematically. And so I would start with the scalp. Do you care if I touch your head? So when I look at the scalp, I kind of take that overall view there and just kind of taking a look at everything. If I see anything that stands out to me, I focus in. That's just easier for me. And you guys can always choose your route of assessment and see what works best for you. So, just looking straight on, I see nothing overtly concerning to me. A freckle here on the back of his scalp, not a big deal for me. And these are things that, you guys may not think about. You see a freckle and you're like, whatever, and if it doesn't concern you, don't stress it. Pretty simple. So looking at the other side of the scalp, all I see is a very cool car. Scalp looks great. And so you think about men, especially who are, have no hair, and the ears as well. These are areas that get tons of sun damage. You don't even think about it. If you wear sunscreen in the daytime, between 10 and 2, great. But if you're someone who drives, just think that left side is getting so much sun exposure. Your hands get so much sun exposure from the steering wheel. So those are just things that people don't really think about, your nuances with sun exposure. So taking special consideration of the ears is super, super important. And so I've looked at the scalp. That's my first approach with a systematic exam. Moving into the ear location, when you think about the ear, there's 2 areas that are very, very important. Do not miss areas, that I call them. And so that's what you call the conchal bowl, which is this little bowl shape area in the ear, and then behind the ear. Because who thinks about pulling someone's ear out like that? No one, right? Unless you're cleaning your ears, usually. And then checking for ticks, my mom says. And so those 2 areas are very, very hidden and also prone to skin cancer as well. Ears look great. And then so moving over to the other ear.
I'm nervous. I got cancer.
No cancer. All right. And so, that's basically your scalp, back of the head, and ear exam. And so that's really all I would expect from you guys. You're cutting hair. I don't want you looking up in his face and doing this number, right? But you're trimming around the ear. So take a look at the ear. You're cutting the head. Take a look. Now, Bill mentioned tattoos, right? So if you know a tattoo artist, I'm sure you also know someone who's had a tattoo over a mole. Anybody know those types of people? You may have one yourself. So, it's not recommended to tattoo over a mole just because it changes the color, the pigmentation, and it makes it much harder for us to assess that. And so, for you, if you are having trouble looking at a mole that's in a tattoo, don't stress it. Send it to someone who has the tools. I have a dermatoscope, which allows me to look into the second layer of the skin that you cannot see visibly with your eyes. So, those are things that I don't want you to ever to stress about. If you don't know the answer, no big deal. Someone does. So that's pretty much your scalp exam and ear exam with a male client.
I think the ears are key. It's why also too we've noticed a trend of those goofy bucket hats, because all of men's ears are getting whacked from the sun. And as you get closer to my age, they start chopping off parts of your ear, which is not a great look. Doesn't feel good either.
My goofy bucket hat is in my car.
Yeah. So it is. The sun is a different beast now, and the fact that people have your trust already, we're already down the road where people are going to start getting better attention, and we're so grateful.
Absolutely.
Thanks, Caleb, for being here.
Thank you.
Caleb is right here in Logan.
Yep.
A barber. Who are you? Who's up next?
So I didn't think of having someone. So.
Yeah, try your mom.
Mom,
come on.
He says, try your mom.
Try your mom.
I don't try my mom, I'm telling you.
Right.
That is not the one. So when I look through a scalp, I use a comb, or perhaps a stylist type thing to kind of go through the layers of the hair, and you guys do the same. So not this one. So in my own practice, I use something like this. Okay, can you hold that? So just going through the scalp, for a female, it's the same approach, right? But you want to make sure that you are, effectively going through each layer, and you don't want to take on too much hair because then you can't see much, right? Just like if you're applying color with foils. If you grab a huge chunk of hair, you're gonna miss some spaces, right? And so same kind of deal as far as assessing. So here we go. You can lower it. You think I've ever touched her hair like this? She would not let me do this. So, and I'm just taking special consideration of those areas where those creases are. If you think about women who have middle parts, right? So much sun exposure there as well. And so that's just something that you can be mindful of whenever you're educating your clients about, sun exposure and sun exposed areas. I'm eating this up. She wouldn't let me do a skin exam on her.
He's always.
We've got a good camera shot of that.
He's always trying to.
Oh, great. Yeah, that's wonderful.
Yeah. Good camera shot.
Yeah, and so with these types of things, of course, I've taken special consideration of that concha bowl, like we talked about, behind the ear. With women, though, you don't really worry as much about sun exposure or skin cancer in those areas. It's always something that can happen, but you're not as concerned about it.
But the nail technician who's here today, hi, they want to be looking at hands as well, just as Caleb was talking about with the steering wheel. So you want to pay attention to not just fingernail beds, but hands as well, because hands take a beating, especially for people who are driving a lot.
Well, and you put sunscreen on your hands, right? But you're washing your hands so frequently, unless you're reapplying very consistently, then you're probably not getting much.
What about parts and hair? Do people put sunscreen? I mean, I use sunscreen on my head, but there's no hair. So if there, what about women and parts? Is it a good idea to use sunscreen?
Yeah, it is.
Yeah, definitely.
Yeah.
And if you have any recommendations?
Well, I would say also, like all of us, I'm sure, do color cuts. So we're going through the scalp and the hair a lot. Like we're seeing every bit of it with sectioning and foiling and cutting the hair, shampooing the hair. So if there's something, we will most likely see it.
Good.
Yeah.
You're so nice to open your shop and be our own little experiment here to be out there in the world. And I'm so grateful to both of you. What I'd like to be able to do now, if it's okay, is to kind of open the floor, if that's all right. And maybe we can see if anybody has a question. Does anybody have a question? I didn't realize you were going to be here today. So no. So can you tell us a little bit about what you do at Coalfield Health?
Yes.
Can you?
My name is Anitra Ellis, and I am a nurse practitioner at Coalfield Health Center. One of the cool things that I get to do is I get to do home visits. So the people who do have issues with access to health care, I do get to go into their homes and provide care for them.
That's great.
So out there, I kind of do it all. They definitely get a skin assessment and just, asking them if they have had any changes in their hair, skin, or nails. Patients know their bodies better than anybody.
Right.
And so if they see something, they will say something a lot. Sometimes they will overlook it, and sometimes there's just time they can't see it. But definitely ask your patients, your clients, if they've had any changes in any areas of the body and things like that, and that way you can kind of see.
Great.
But I think this is great. I want to say, Caleb, I'm thinking from a nurse practitioner standpoint, man, there are different signs like on a patient's neck that tell them if they have diabetes, their breath. I'm like, how can I get this out there to people like this? Because they will, as you guys have mentioned, they will, get their hair done and things like that.
You're a nurse practitioner?
Nurse practitioner.
And where did you go to? Did you go to school here in West Virginia?
I was at a Southern student, and I actually was
all these geniuses from this amazing school.
I actually was a nursing instructor there too, so I had Caleb in my class, and I got to do some precepting with him.
I love that.
Yeah, so.
I love that. I love that we have so many educators here that are training the next generation, which is actually our real name of Less Cancer is Next Generation Choices Foundation. And it is, I love that you're doing this, and I'm grateful for your leadership.
I appreciate it.
So is the Less Cancer community. So just keep on going.
Absolutely.
And thanks for letting me introduce you.
No problem at all.
Thanks so much. Thank you. Is there anybody in here that just has a question, wants to say something?
Hey, Bill, thanks again. I thought about one other thing that we didn't talk about today, and I don't want to leave it out.
Okay.
So we focus a lot on the clientele that comes into salons. I want to just briefly talk about, those of you who are the providing the services and, making sure that you are also protecting yourself. So we do know that some of the chemicals that perhaps are used in hair salons and, and doing the nails that have been linked with higher risk of cancer. And so the salon there looks fabulous. I think if I can get in the car and drive for about 7-8 hours, I would love to come there. But I think making sure that when you are there, that the salon itself is well ventilated. so that you're circulating that air as you're using all those different chemicals. You want to make sure there. You also want to make sure that you, especially for our nail techs using some of the gels, that you are doing, using some self-protection. So masking, particularly when you're using those kinds of things, because those chemicals can get in the air and you might be inhaling that. And, you've got a long day of clientele. We also want to make sure you're lowering your risk as well. So just want to say that there are some other things to help protect the stylists and the technicians to lower your risk of cancer if you are somehow being exposed to some of these chemicals that we think might give you a greater risk. So I know most of us are in the service field, and we're, servant leaders, and we're always considered, thinking about other people. But I also want you all to make sure you're doing your due diligence to get your own screenings and you're protecting yourself as much as possible.
I'm so glad
Thanks.
I'm really glad you brought that up, Dr. Baskin. It was something that I thought about talking about today, but we had so much on our plate. But I'm really glad that you brought that up. Heads up on, just so we can go over, hair color, hair straighteners, nail gels. Those are kind of it for the ones that the people in this room really need to take precautions on. Is that correct?
Yeah, those are the ones that we know most about. But again, science is still trying to make definitive, understandings of what the links are. So again, it gives you a higher exposure to some of the products that are in, some of the ingredients that are in these products that might. So it's not saying absolutely or not. But there is a reason to think that people that may have prolonged exposure to some of these chemicals may be at greater risk than people who are not. So, it's again, like less cancer, it's about prevention. A lot of what we do is to try to minimize the risk for the things that we can have control over. There are lots of things we don't have control over. So things like, again, making sure there's, well ventilated, you're getting air circulating in and out, so that you don't have that concentration of those chemicals building up. Wearing masks, which I'm sure your nail techs are doing that anyway, just again to kind of keep from having those types of chemicals coming back in, and again doing your due diligence and making sure you're getting all the different types of screenings possible. So we focus on melanomas here, but again, as my colleagues have also said, and all kinds of cancers, we have tremendous treatments that are available if we can catch it. And the earlier we catch it, the more options you have. So keep up with your age appropriate screenings. The materials you got both from Massey as well as West Virginia have some general guidelines there. Reach out to Mary Ellen and her team for sure, to ask if you have any questions. As she mentioned, they are focused on doing all kinds of education in the community. They're local, and you've got so many tremendous resources right there at home that I encourage you to really take advantage of.
And also, too, I'm not an expert at this, but I think there are some less toxic, less risk products out there. Early on, Less Cancer, maybe 15, almost 20 years ago, we were part of a collaborative to help identify personal care products with harmful chemicals in them, and which the list is long. Just because something's legal and for sale doesn't mean it's good for you or safe. So, do your due diligence. Thank you so much, Dr. Baskin, for bringing that up. And is Mary Ellen on? Trisha, anything else, Trisha or Mary Ellen, you'd like to say? Trisha.
I just want to thank you and everybody in this room for this contribution, because this has been very uplifting, very broad in scope of what we've covered in a short period of time. And I'm completely inspired by this experience. So thank you all for.
Thank you. I'm inspired too by all the people in here. And we've done these workshops for over 2 decades. I've never done it in a hair salon, right? We've never done this in a hair salon, and I love it. I want to do it.
I love the seats you were sitting in.
I want this for my living room because I can't get out of my chair, so it gives me a head start, right? But these are all experts, and this is what really matters. The experts in this room, the experts on the screen. I'm really just a disc jockey here. So it is, oh, thank you. But we really need to pay attention to the science, the resources, the experts, and really make that part of your mantra, because rumors on social media, which I use a lot, are rumors. So unless you see like a link to the resource or a study, or there's somebody like these wonderful experts here, you know, that's what should guide you going forward as well. So thank you everybody for being here. This was really fun. I'm really grateful to everybody on Zoom and everybody here. And glad for the opportunity. And Caleb, thank you so much. Christine, thank you so much. And thanks everybody for being here.